because in clinical practices, the sound judgment demands thorough documentation, and the documentation has to be in the based on the principles of Alcoa guidelines, which I can suggest you. Alcoa, obviously, you can Google it and find it out. Attributable, reliable, timeline, and all that. But the thing is that accountability in documentation, what should be there, is not over there. If it is a standalone hospital or clinic, one cannot go ahead with, because this is a definitely a dedicated or a dedicated work, and it has to be definitely, what I can say, given to a person who understands that. So obviously the cost is going to increase. So what you are suggesting is EHR is should be made mandatory. I can suggest it that way, so that the work stress also will be reduced. But primarily, what you are trying to tell me, in my experience, if it is a heavy workload and I have to satisfy my patient first, unless and until I satisfy my patient, I am not going to get more and more patients. So obviously I am in a soup now, that I have to I have to fulfill this patient's criteria also. At the same time, I have to fulfill the completion of the legal document, considering every patient is my prospective legal troublesome patient.
So, what happens is, I guess, what you're trying to say is that the records are not prepared and documented at the time when the action is happening. It
Yes,
is expected that it will get recorded later.
it happens.
Yeah.
It
But
happens.
what we can suggest is a unified case management
Mm-hmm.
platform where even the data entry gets date stamped, and
Yes.
thus uh, there is a kind of atmosphere or an environment where there is an incentive to people recording or documenting the situation there and then, and that of course requires a lot of training. So
Yes.
we have a learning management process also,
Okay.
whereby the staff is trained
Yes.
to do the documentation there and then and
Okay.
avoid the problem that later on it gets sort of missed.
Mm-hmm.
And that is what I think would take care of the problems that you mentioned.
Yeah.